Iohexol solution is a medication used before X-ray imaging tests, such as CT scans. It contains iodine and belongs to a class of drugs known as contrast media or dyes. This medication works by adding contrast to body parts and fluids in imaging tests, which improves the quality of the images obtained during a CT scan. This helps your doctor to more easily diagnose your condition. It is important to follow your doctor's instructions regarding the dosage and timing of taking this medication. Before your imaging test, your doctor will provide specific instructions on when and how to take Iohexol solution. You will usually take this medication by mouth, just before the imaging test. The dosage of Iohexol solution is based on the specific imaging test and your age. It's important to drink plenty of fluids before and after the imaging test, unless your doctor advises otherwise. This will help to flush the medication out of your system and ensure accurate results from the test. If you experience diarrhea, nausea, vomiting, stomach pain, gas, or headache while taking Iohexol solution, it's important to let your doctor or pharmacist know. It's possible that these side effects may go away on their own, but if they persist or worsen, it's important to seek medical advice. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Many people who take Iohexol solution do not experience serious side effects. However, it's important to speak to your doctor if you notice any signs of kidney problems. While it's rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before using Iohexol solution, it is important to inform your doctor or pharmacist if you have any allergies to contrast media, iodine, or any other substances. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss any concerns with your pharmacist. It is also important to inform your doctor or pharmacist about your medical history, especially if you have asthma, hay fever, or kidney disease. If you are planning to have surgery, it is important to inform your doctor or dentist about all the medications and herbal products you are currently using. If you are pregnant, this medication should only be used when necessary and under the guidance of a doctor. It's important to discuss the potential risks and benefits with your healthcare provider. If you are breastfeeding, it is unlikely that this medication will pass into breast milk when taken by mouth. However, it is important to consult with your doctor before breastfeeding while using Iohexol solution. When taking Iohexol solution, it's important to be mindful of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It's important to keep a list of all the medications and products you use, including prescription and over-the-counter drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. One product that may interact with Iohexol solution is metformin. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has taken too much Iohexol solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's crucial to seek help immediately in such cases. Never share Iohexol solution with anyone else. This medication is prescribed specifically for you and should not be used by anyone else. Sharing Iohexol solution with others can be harmful and may not be safe for their condition. Always consult with a healthcare professional before using any medication. This medication is given as a single dose before an imaging test. It is important to take the medication at the time prescribed by your doctor. If you forget to take the dose, your imaging test may need to be rescheduled. When you have Iohexol solution at home, make sure to store it in the refrigerator or at room temperature, away from light. It's important not to freeze it and to keep it out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.